Cases of measles in Ontario continue to climb.
Health officials say the vast majority are among unvaccinated people, but there is a tiny percentage of people who have been vaccinated. CTV's health reporter Pauline Chan has more on so-called breakthrough cases.
The latest numbers show Toronto steady at 2 cases of measles so far this year, with an additional exposure from a visitor to the city at Woodbine Mall's Fantasy Fair last month. But around the province, the numbers have been climbing.
There have been over 900 documented cases, and it's only April, whereas, for example, in all of 2024, there were 64 cases. So the outbreak is ongoing.
And in the U.S., numbers are also climbing, particularly in Texas. And while the vast majority of cases are in unvaccinated people, 3% have been found in people who had received 1 or both doses of the measles vaccine.
In medicine, just like in life, nothing is 100% effective 100% of the time. And there are a handful of cases of breakthrough infections in people who have received both doses of the measles vaccines.
Dr. Isaac Bogosh stresses it's an extremely rare occurrence, but it does happen, and with other vaccines as well, such as influenza or COVID.
And those who do have infections tend to have less severe infections thanks to the vaccine. But by no means do they prevent infection to nearly the same degree that, for example, a measles vaccine would prevent infection.
1 dose of the MMR vaccine is 93% effective at preventing measles. The second dose brings that to 97%. In Toronto, school suspensions began this month for students not in compliance with the Immunization of School Pupils Act, or ISPA. So far, 1,924 students born in 2008 have been suspended. That was the group most affected by the pandemic halting school vaccination programs. Students who do complete their immunizations can return to classes before the 20-day suspension is up, and more than half have been doing so. Toronto Public Health expects that by the end of the ISPA assessment process, vaccine compliance will exceed 90%, consistent with cohorts from previous years. Pauline Chan, CTV News.